Welcome to our webinar, and I'm very pleased that we have been able to put this really nice and important topic together. And the title, as you can see here, is Breaking Barriers: How can artificial intelligence support victims of domestic violence? Before we start, I would like to let you know that this webinar will be recorded and will be put on YouTube. So please remove your name or change your name if you do not want your name to be shown. Just to let you know before we start. So I'm very happy to welcome you, as I said before, and my name is Bettina Pfleiderer. I'm partner of the Improve project, and I'm a physician coming from the University of Münster, and I'm actually heading lead of work package 3, which means designing training materials and doing trainings in general. So after a brief introduction to Improve, we then move on to have an introduction to the topic domestic violence and the role of artificial intelligence. Then we move on to AinoAid as an example of field support in cases of DV. Then Miko will continue how algorithms impact us. Then we have a question and answer session moderated by Jasmine. And then we'll have a wrap up and farewell by Anna. And just to let you know, please type your questions you may have during our inputs in the comments section of this webinar. And then we'll respond to all questions at the end of these 3 inputs. So please just keep them either in mind and ask them to us later, or even better, please put them in the question in the box for comments. Okay, so what is Improve all about? And Improve is an acronym for Improving Access to Services for Victims of Domestic Violence, and then to accelerate change in frontline responder organizations. It's a EU-funded project, and it's started in October 2022 and goes to October 2025. We have 7 partner countries: Austria, Finland, France, Germany, Hungary, Portugal, and Spain. And in the focus are particularly vulnerable groups in the context of domestic violence. And the main object, or there's a lot of other objects, but the main objective is to develop a chatbot for victims of domestic violence and development of tools and teaching materials for first-line responders like police, health sector, social sector, and justice system. We also have a video produced, and you can find it if you scan this QR code or go to our webpage. And the video actually follows Charlie's journey through the complexities of a very difficult relationship, and also highlighting the questions that many people in that situation may face. Is it domestic violence or not? And what can I do? Where can I find help? And this you can find in this video. And finally, as I said, we have in this European training platform. Also, you can scan it here to access it. And on this training platform, you can find a lot of the materials we are also shortly showing in my presentation, which now starts here. I'm giving you the framework: what is domestic violence and what is artificial intelligence. And then, like I said, Anna will take over to show an example for a chatbot which uses artificial intelligence. Well, let's start with some facts and figures on domestic violence. First, this is the definition we used in the project, and it's based on the Istanbul Convention, Article 3. Refers to all aspects of physical, sexual, psychological, or economic violence that occurs within the family, domestic unit, or between or current spouses and partners. That means it can be also children and parents, or grandparents, or friends. It just matters that it has a closeness to the person being affected by violence. It is still happening today. Everybody knows that, of course, that unfortunately 1 in 3 women in the EU and globally have experienced physical or sexual violence at least once in their lifetime. And unfortunately, it has not changed, despite we have so many programs and money put into it, and it's still an issue. And that's why it's important to really find solutions. They may work better to reduce violence. Then 4 in 10 incidents of violence occur at home, and only 2 of 10 incidents in public or at work. So home is not a real safe place for women and actually all other victims. At least 2 women are killed every day in the EU by an intimate partner or family member. And this is really, I think, a very depressing number. So you see, it's very important to prevent femicides, to get an idea how can we intervene before we have a femicide at the very end, to identify victims much earlier before they actually being killed. Therefore, it is so important to break the silence, because only 22% of women in the EU who actually experience intimate partner violence report it ever to the police. So these are 80% who don't report are the dark field, and they need our support. What are the forms of domestic violence? Well, domestic violence can take many forms, and some of them are listed here. And these forms can cause very serious health and mental health consequences and impact. And violence does make victims sick and ill. And the perpetrator uses whatever works to assert power and control. And he or she uses fear and intimidation. I want to highlight a special forms of violence, which is a psychological violence. And this is really the hidden pandemic. Nearly half of all women in the EU, 44%, have suffered psychological violence from a partner in their lifetime. But the problem is, this violence is the most hardest to identify and to detect, because they usually don't come to the emergency rooms with visible injuries, so that you have a chance to really identify these victims more obviously. And this is a problem, but psychological violence is one of the most, the form which has the most prevalence, I would say, but it's very difficult, like I said, to identify. And this is also something we need means for victims who actually experience psychological violence to report this, to understand that it's psychological violence, so they know it is domestic violence, it is not correct. These are the signs that what perpetrators do to exert psychological violence, and this is a lot of lack of knowledge about this actually. And as there isn't enough time for me to really go through all these forms and dynamics of domestic violence, I want just to allude that this you can all find on module 1 on the training platform, on the European training platform. All this is mapped out, explained in detail for those who may want to know more. And then by scanning the QR code, you will come directly to module 1, or you'll find it online. See the signs. As I said, it's not always obvious. It may be hidden. It's at home. It's behind closed doors. And if the victims don't need to come to the emergency room, it's really hard to see it because signs are hidden. Over 80% of women in the EU who experience violence do not seek professional help. Improve, this EU project we are all representing, had developed a comic campaign how to recognize domestic violence. This is an example, and you will find this in our training platform as well, and also on the web page, and it's nicely explained what is psychological violence, what is ecological violence, what is sexual violence, in a very easy to understand way. So please go and have a look, and I think it can be really useful to understand what is behind all these forms of violence. Questions people may have: why do many victims not leave the perpetrator? Well, there's a fear of further violence, isolation and lack of resources, because that's what perpetrators do. They isolate their victims and also, reduce the access to financial means and so on. There's a lack of support, maybe of family, beliefs and feelings that it's normal, that they're treated like this, that they deserve it because they have done something wrong. And impact, as I said before, is a lot. Say minimizing it so that they really try to say, oh, no, it's not a problem. I can deal with it. Don't worry about it. Denial. He's a very nice person, or she's so very nice. No, it just happened once and it will never be happening again. Or rationalization to find some reasons why he or she had actually hurt the victim. Then there's, of course, if you're affected by domestic violence, that you are stressed. That will show at work. You may make mistakes. You have a lack of sleep. You even may start with drugs and or alcohol abuse, just to be handling better the impact, what you're feeling and this trauma. And of course, you blame yourself because you think it's all your fault. And, so if you had behaved better, the other person had not to be angry with you or, do something to punish you because you deserve it. So just after setting this frame, it's obviously that we need also low threshold means for people who are affected by domestic violence to get in touch with someone or something, to get first an understanding, is that what I really do experience domestic violence, or is it okay, or is it normal, or if you have questions, or even if they sure that it is a problem and they don't know where to go to, it's important to find some way to ask someone. And here comes our project into play, because like I said, you'll learn later more about it, about the chatbot, the use of a chatbot. And this chatbot uses artificial intelligence. And so the question is, what is artificial intelligence? We're hearing this all the time, and not everyone knows for sure what is actually behind this term. So artificial intelligence refers to the development of computer systems that can perform tasks that typically require human intelligence. So what they can do, they analyze huge amounts of data, they extract patterns from all this data and make, based on this, predictions or decisions based on this information. Basically, they develop also their knowledge further by analyzing data they can get and improve, so-called, their ability to respond. We're having two forms. There are practically many more, but I just introduced two to you. One is weak artificial intelligence. It's called also narrow artificial intelligence. And these are machines, they respond to specific situations, like Siri, you know that, Alexa, Google Assistant. These are the typical representatives. And they cannot think for themselves. They usually just do, you know, Alexa, please find the phone number for the next pizza restaurant near my street, or Alexa, could you just play the music I heard 2 days ago and it's about this and that? That Alexa can do, or Cortana or Siri can do. But they are just designed for specific tasks within a limited domain. And then we have the strong artificial intelligence systems. They are also called general artificial intelligence. And this machine is able to think and act like a human. It is able to learn from experience. We have not yet real life examples of a real strong artificial intelligence machine yet, but you know, the best representation would actually how Hollywood portrays robots. You may have seen the movie like Robert and I or something. It's just they behave like humans, their feelings, they start thinking like a human and do things like this, but we have not this yet in reality. And then the last thing is machine learning. And these technologies and algorithm used by machine learning allow systems to, like I said, recognize patterns, make decisions, and improve themselves through experience and data without the help of humans or new programming. But they are not behave like humans yet. And I've brought you 3 examples. One is image and facial recognition. For example, if you're at an airport, there are programs, I know of some countries that use that. They have face authentication, can ensure that only the appropriate person has access to sensitive information. So this is an example. It also can be used for some security doors and other measures. Anyway, so the program is able to say that is your face, and I know for sure that is your face, or they can identify in the movie the face of people for sure, and so on. Then we have the medical diagnosis. It provides actually more exact diagnosis in say some instances, and they can detect hidden patterns in imaging information. Say if I have a scan of the breast, a magnetic resonance imaging scan, and then the application based on artificial intelligence can check what they see and say, well, here is something which may look suspicious. And this is very helpful because then the radiology person can look at it and then further characterize it. Or they can predict how patients will respond to specific medications. And this actually leads to better treatment strategies, fewer clinical errors, and actually more accurate diagnosis, because these systems never get tired. And it's in the middle of the night, and the radiologist may be overtired and may overseen small things, and this the machine does not. And so, like I said, it's helpful. And then we have the chatbot, and chatbots offer round-the-clock assistance. They are having personalized interactions, and they can really efficiently handling all forms inquiries. And therefore, chatbots are really helpful, like being available around the clock and giving some answers of very important questions to people. And this also is enhanced in user certifications and cost savings. And you probably have encountered these chatbots if you go to a website and ask for something, because of the chatbot says, do you have any question? How can I help you? And so on. And you type in and this chatbot gives you a response. So you have encountered this in various forms already. And like I said, the chatbot is something we'll talk about. But before I hand over to Anna, I want to share you what actually victims of domestic violence think about chatbots based on artificial intelligence. And the question we had asked them, that was a part of a project of Improve. You know, what do you feel about this tool? Would you like to use it? What are your worries? What do you see as actually positive things to use it? And so this is the summary, what they said. There are some challenges, concerns, and barriers these victims see when using it. They think that chatbots are cold with a lack of closeness. And they think that it's very important to have a human agent to whom they can refer after a first response of the chatbot. They also have a lack of trust into the technology and its safeties. They say, oh, if you know, if you share personal data, where does the data go to, and so on. And then what happens if you don't speak the language of the chatbot? What when you have a different native tongue? And what can you do if your ex-partner or partner has a very extreme control what you're doing? And also there are worries that the conversations with a chatbot could trigger traumas, re-traumatizations, and there's no one there who can actually pick this up and do something to work with you on this trauma and to minimize the re-traumatization. However, many also had opportunities for chatbot. They really were anticipating. And one has to be honest, many who gave answers that they may be afraid, they have actually a lack of experience with chatbots. So it's just an assumption or what they assume a chatbot is. However, despite that, they expressed a positive attitude and would use them if they were anonymous. And they think a chatbot is a tool at the first place to find information and guidance when experience domestic violence. And they think a real opportunity is that they can use it anytime, anywhere, and get immediately answers. A chatbot would not express any moral judgments, and it would be really useful for persons who have no or very little social support. Like I said, perpetrators usually isolate their victims, and also when there are severe language barriers. And I hope that the chatbot might be adjust to their language and may help them in their language. So thanks a lot. And now I'm done with my presentation, and thank you for listening to it. And now I hand over to Anna. Thank you.
Thank you, Bettina. So now I will share the presentation. Hope you can all see it nicely. So my name is Anna Juusala, and I'm here to present AinoAid service as an example in the field of support cases of domestic violence. And I'm from We Encourage, and today with me is here my colleague Ulla, and also Katja and Elli-Mari should be as guests in the webinar. So, AinoAid service is professionally curated knowledge base and integrated AI-based chatbot that retrieves information from the knowledge base. Basically, for the users, it is a normal website, and the chatbot is embedded into that website, so it's accessible via that. So it can be used with smartphone, tablets, or computer, and there is no need to download anything. It is an easy and continuously learning source to find, access, and use information on domestic violence. And as Bettina said, most of the victims would like to first understand what's happening to them, gain knowledge, and so forth. There is, of course, ability to also add country-specific information in local languages. The bot in itself is multilingual, and we have started now with testing in Finland during February with first external testers, and we will be launching here in Finland in April. And following that, we are adding the Germany, Austria, France, and Spain, where we will be then testing the bot as well. First in focus is to support people impacted by domestic violence. It is not limited only to the victims, but actually we are also aiming to support perpetrators, the close ones, and even professionals can find information and guidance from the tool. It encourages the experiencers to learn about the issue and overcome the shame, which has been identified as one of the most common barriers that makes people hard to find help from human beings and to reach out for help. When we gain volumes of users, it brings us insights to better serve the users. In the long run, there will be support for and, of course, user insights to help also the frontline professionals to improve their effectiveness and the impact.
So let's take a look at AinoAid website. So first we have to choose a location so that we get the country-specific information, and currently we only have the Finnish localized information, and then we choose the language. Here on the landing page you find the shortcuts to the knowledge base information, some recommendations for further reading, then there is a little bit of information of improve AinoAid ecosystem and so forth. And the browsing through the website is like in any other normal website. So you find menu items here and you can start looking for different information here. So for example, we take a look at the forms of violence and we find that there is more information on these accordion items, and then you can find more information on each forms of violence. We know that mental violence is one of the hardest forms of violence to recognize, so we now are a user who is looking for more information on her experience. Aino reminds not to share any personal details, and we have precautions, of course, to make sure that as much as possible we try to make people feel safe when using this. So we also ask permission for users that we can use the data for training and improving the services, and of course the using of AinoAid services, the chat and everything is completely anonymous, so we don't track the user in any way. So now we can start chatting, and Aino also reminds that it's not there to replace human beings, but rather it is a complementary service. So it always tries to recommend people to seek help also from professionals, maybe in some cases from their close ones, trusted family members, and so forth. So the person is wondering, I don't know if I am overreacting, but I feel bad because my spouse is constantly criticizing me. Criticizing, let's see if I don't understand what it means. So AinoAid tells that the feeling bad because because they're constantly being criticized, and it is important to remember that their feelings are valid. The user has also now, they have been reading about the mental violence, but they are unsure if they are being mentally abused. So Aino explains that it is not a mental health professional, but it is able to provide some information. So of course, Aino cannot know, like normal human beings couldn't know if someone is being mentally abused or not, but it can give some signs what type of mental abuse there, what kind of signs there might be that you could recognize. So there is a term, gaslighting, and the person doesn't know what it means. So Aino explains what does gaslighting mean, but the person is unsure that how do I know if if someone is gaslighting me. So Aino explains that it might be difficult to recognize, but there are some signs. For example, if someone denies or dismisses your feelings and experiences and so forth. So this is in a nutshell how AinoAid services and the chatbot functions.
Yes. So why AinoAid is created and what kind of support it could bring also from the economical perspective. We know that based on the recent study in Finland, the yearly cost of domestic violence brings 60 to 90% additional costs for social services, 70% for legal services, including the police. And the estimated direct additional cost to healthcare from physical violence is 150 million euros. And added to that, the cost of mental violence brings the value to 861 million euros. However, only under 1% of victims of domestic violence, based on this recent study, is recognized by the healthcare professionals in Finland, even though they use 80% more of the healthcare services than the people who are not affected. So there is the motivation by the governments also to do something about this issue, even here in Finland, the happiest country in the world. So we know from the previous slide that the annual direct healthcare costs in Finland go over 1 billion euros. And there are annual saving targets for Finnish public healthcare between 24 and 27, 995 million euros. So based on these numbers in the research, if we could go from recognizing under 1% to 2% of those victims, we could bring savings already of 20 millions. And moving further towards 4%, it would already increase the savings to 40 million, not even to talk about all the psychological aspects of how it would impact on people. So when we are able to provide more knowledge, more information on these people, help them recognize their situation, maybe even a bit earlier in their life, and also help and encourage them to seek out help, and also to be able to give them recommendations which health providers they should contact in which stage, we already are going towards the path that we are creating the impact. And we know that we cannot do this alone. So Ulla will now explain a little bit about the collaboration and how to make an impact.
So we know that all these hazardous journeys in the past were not be able to done by anybody alone. And I hope you can see on a slide because the window changed for some reason.
Let's see if it's back.
Yeah.
I don't know why it did that.
Yeah. So so if you think about the grand challenge, it's worth solving together, and nobody can do it alone. So we need to understand that we get different actors coming together and working together address the issue what we are here discussing about. And we are actually calling for all of those brave people, independently of the gender or any other identities, to work together so that we can start looking at the ways how we can be brave and leverage something new in terms of technology from the perspective of the service providers, but also for the users. As Bettina said, these are new ways of providing the services, providing the help, and it's never easy when you are in a kind of like a pioneering in the field. So we believe in collaboration, and if we have anybody there who is listening to us and is brave enough and is excited about the challenges, but also has the goal for making a positive impact to those people who are in need. So we are more than happy to receive your request for the collaboration in order to transform the ill-being to well-being and stop wasting of the resources, as Anna explained, what we are doing at the moment as societies. So simply come together, work together, and be brave enough to use the new type of tools and also new type of ways of working together. And handing over to Mikko, who is the expert in algorithms, and he will teach us that what we need to understand when we are dealing with the AIs and machine learnings. So Mikko, please, the floor is yours. And thank you for coming here.
Can you hear me?
Yes.
Okay. Can you also see the presentation now? Okay, good. Yeah, did you hear anything I said initially, or like did it go away? I just want to make sure that.
Please start again.
Yeah.
Okay. Yeah. Okay. Hey everybody, my name is Mikko Lasarla, and I'm an expert in algorithmic influence. I've been speaking about it in international conferences and also in media houses and corporations about the impact of algorithms on lots of different things. So we have kind of moved to the age of AI. So everything that we do, all our decisions, everything around us has been and is currently being affected by algorithms. So this includes like all these recommendation algorithms, all the personalization algorithms, all the notification algorithms, and other algorithms that are shaping your behavior in one way or the other. So we cannot anymore say that we are in control of these algorithms, like as societies and as humans. Like we have to understand that our opinions, our ideas, our behavior is constantly being affected by these algorithms. So by understanding it, of course, we can adjust our behavior, but by understanding it, we can also understand better how the societies are changing. So let's talk about social media a bit. So social media companies have been working to increase the session time of their users ever since they've been founded. The reason is that their business model is based on advertising, and this advertising is driving all of their revenue. And when your revenue is coming from advertising, the more views you give for the ads, the better money you make as a platform. So we started with Facebook originally from a model where you friend people. We moved to a model where we follow influencers with Instagram, and then we have been moving to this new model, which is completely based on algorithm, which is TikTok. And because TikTok's absolutely massive success in the marketplace, every other social media company has also changed their model towards this kind of algorithmic content feeding. This means that in the last 15 years, we have moved from basically communicating with friends, which was the original starting point of social media, to a situation where we have gone back to the era of TV, where we have now user-generated TV that is algorithmically fed to us in a never-ending feed of personalized content. And that's actually anti-social. And so I'm calling the social media of today the anti-social media. And these algorithmic content feeds are actually having an effect on us. Studies show that social media fuels violence. So when somebody likes to watch like a violent video, like let's say that a young man sees a video of fighting and they like that video, they will be fed more of the same. And and by having this like never-ending feed of violent videos then coming up as entertainment, it actually does have a psychological effect on the person. And basically, there's only one thing that it has bigger correlation in negative effects of media, and it's smoking and lung cancer. The second most correlated thing in terms of harms is media violence and aggression. So we can safely say that violence, like in terms of our entertainment, will affect more violence. The other thing that has happened with the algorithmic models is that we have been put into these filter bubbles. So because of whatever we want to see and watch online, we will be fed more of that. This has actually started to diverge the viewpoints of women and men in all of the countries where this media is being consumed. The situation is especially bad in South Korea, where the divergence has been absolutely massive. But the same trend is actually true in all of the Western countries. So we are basically now, through those algorithmic feeds, creating a different worldview for different groups of people, including men and women. The social media affects also domestic relationships in many ways. So not only is it like a divergence of worldviews, but there's also the actual effect of addicted use of smartphones and other devices. It actually has an effect of degrading the quality of domestic relationships. And according to studies about people who are not using smartphones during their home time are 11% happier than people who are regularly on social media when they're at home. Another thing is that in these social circumstances, like when people are like using dating apps, 65% of Tinder users are actually already in relationship. So if you look at from this perspective, like there's a lot of avenues for destroying relationships and other things like through social media use. And social media can also be used for stalking, harassing, and creating alibis, like when there's intended violence or intended bad behavior. But it can also be used positively to uncover threats, show false accusations, and demonstrate the abuser's control, as an evidence when there's such a situation. But what we are doing today, instead of starting to understand all of these problems of social media, we actually let our teens to spend most of their waking hours on it. In last October's study by Gallup, US teens spent 4.8 hours a day on social media, out of which they spent 4.3 hours in YouTube, TikTok, and Instagram short video formats. So basically, we have addicted our youth to never-ending feeds of short videos, which are typically between 15 and 30 seconds in length. So that means that our kids are basically getting a absolutely never-ending, insane onslaught of entertainment, which is basically like targeted to their own psychological weaknesses, and this has caused lots of problems. We are now calling the current generation the anxious generation, and we are basically causing them 4 foundational harms that are social deprivation, sleep deprivation, attention fragmentation, and addiction. And these are all going to have an effect on like the whole populations as they grow up. We also have a clear trends now of reducing abilities in school. So the excessive smartphone usage is having a negative effect on the learning results. And we also have knowledge that the countries that are restricting the smartphone use during the school time, which are Japan and Korea, have the best results on PISA scores tests. So we have a clear evidence against the use of smartphones during school days. We also have to understand that this information is not only algorithmically fed, but there's also like intentional like worldview shaping things that are happening in those platforms. So we have to understand that in TikTok's case, China's moderators, content moderators, are also behind the TikTok's moderation engine, not only its Chinese version Douyin's content. And this content is basically filtering out all the negative like the videos about China, but in addition, they also have a preference for specific types of content that are shaping the global discourse today. So we have to be really careful and understand like how these like short videos are affecting people. Many dangerous challenges spread on TikTok today. So people are taking part of these challenges, and there's been numerous deaths, numerous like hospital visits as a result of these challenges. The interesting thing is that the same kind of like challenges started spreading in Facebook in the early days of Facebook, because apparently the youth likes to spread these kind of challenges. But they were sweated like right off the bat, and the whole thing was kind of like there was absolutely no virality or no spread on those kind of challenges on Facebook. So we know that it's quite easy to detect the viral distribution of this, but for some reason every other platform except for TikTok is moderating their content to remove this. So from my perspective, we have to assume intentional harm. And that's not the only thing. We also have to understand that the generative AI that is currently being used by more and more people, actually hundreds of millions of people are using AI daily to generate content, either images or videos or voice or text. And now it's been estimated that by the end of 2025, 90% of all content on the internet will be AI generated. This is quite reasonable estimate from my perspective, given how easy it is to generate like absolutely insane amounts of content with AI. So this creates like a very difficult environment for us to basically believe anything that we see online. So what we have to do, like the only escape that we have is to basically move ourselves to places where we can do like safe social networking, which in this case is group chats. And that's basically what has happened. So people see now group chatting as their actual social networking, and the traditional social media that existed is only media today. So that's it for this time. Like I tried to keep it short and sweet.